Welcome to Techwire. I'm Christina Gagnier, and today I'm joined by Cruz, the Chief Information Officer of the Department of Healthcare Services for the state of California. Chris manages one of the largest healthcare organizations in the world, with over 500 employees, $1 billion in healthcare IT projects, and is chiefly responsible for the administration of healthcare access in the state of California. Chris, thank you for joining me today.
Great. Thanks. It's great being here, Christina.
So you are in charge of the Department of Healthcare Services, which in California is probably one of the largest healthcare delivery departments. You're in charge of access to healthcare services, managing over $1 billion in healthcare IT projects. How does that work, being the leader of such a large organization?
Wow, it seems overwhelming when you say that. Really, it's a big organization. It's getting larger every day, and with the advent of healthcare reform and the Affordable Care Act, the department continues to grow and develop. There's many initiatives under our organization right now, and it's a big organization, but it's a great organization to be a part of, and there's a lot of initiatives that we're working towards attaining successful outcomes for the people of California.
So our audience is really interested in some of the initiatives that you're working on, so can you highlight some of those banner projects?
Sure. Right now we have the California Medicaid Management Information Systems project that we're currently rolling out. Tomorrow is the kickoff. That's a $457 million project to expand and upgrade our MMIS system here in California. We also have the California Healthcare Enrollment and Eligibility System that we're rolling out, or Obamacare, which is providing universal health care for all Californians here in this great state. We also have provider enrollment that we're working on and attaining a new provider enrollment system for all the providers that provide health care here in California. We have a managed care health care system that we're expanding here as we roll more providers from our Medicaid system to our managed care capitation system. And we also have dual eligibles, which is a new system really to leverage and address people that are providing dual eligible or dual coverage for citizens here in California. So it's a huge effort. We have almost $1 billion worth of projects on the books, and we have multiple people across multiple organizations working on that staff. So it's a busy organization, but the mission of the organization is great in terms of advancing the healthcare needs of low-income Californians.
So like a lot of companies in the private sector, you've scaled up very fast to accommodate all these projects.
Right.
But as government, you have certain constraints in terms of mobility, use of the cloud, and use of social media to make sure these projects are as impactful as possible.
Sure.
How do you manage that?
Well, I think one of the things we were doing, actually, Christina, we were the first department to adopt a BYOD program and a mobility management plan. Our department currently right now has 125 executives that use their own personal smartphone devices. And when I talk about their own personal devices, is they don't get a stipend from government. This is a volunteer program. And the volunteer program saves between $250,000 and $300,000 a year. So it's a great program in terms of mobility. We've also extended our mobility management plan to include iPads as opposed to laptops in terms of replacement. So we're currently doing a research project right now to look at that. Also, we're embarking on a new telework program in our department. We want to retain and recruit our staff, and that's very important. So a lot of times government can't pay additional perks, but it can give perks to people to keep them happy, and that's what we're trying to do in the department. We're rolling out our virtual desktop interface now, which will allow people to work in a virtual work environment anywhere, anytime, any place. And we hope to, right now, complete that pilot and include the whole department within that telework plan over the next 18 to 24 months. So it's very exciting that we're using cloud technology in those particular areas. We're also using cloud technology in our software as a service program. We currently have our HP Quality Center model and our Remedy systems now as software as a service, as well as our portfolio and project management tools as software as a service. So as we roll out these new technologies, everything is going into the cloud. And in March of next year, we're rolling into our new California Enterprise system, which is our email cloud system. At that time, we plan to replace all of our BlackBerries and our enterprise server and go with Apple systems. In other words, we'll have iPhones for everybody. So the 350 users that we have in the department right now currently on BlackBerries will be transitioned to iPhones, and we'll discontinue the BlackBerry server. So all in all, with software as a service, we see a huge reduction in savings coming to the state by going to a distributed maintenance program and a service that's provided in terms of a distributed process.
As the CIO of the California Department of Healthcare Services, can you talk about some of the challenges you face day in and day out?
Well, I think some of the challenges that we have is recruitment and retention of staff, budget cuts. We're being asked to do more with less. But with the technologies and consolidating technology is actually helping us do that, and the outcomes we're seeing are being more successful. I think that's the biggest key. And with an organization this size is retaining also new leaders and bringing new leaders up. This is not an army of one. This is an army of many. And this is where this department needs to be. As a CIO, I set the strategic vision and help with governance and the strategic planning for the department. But I need management team and leaders to help me execute, and that's most important in these challenging times. And I feel like as a department, we're doing that really, really well.
And how do you define success? So you have all these initiatives going. How do you define success, and how will you know when you get there? I think particularly with some of the healthcare services stuff that's coming on due to Obamacare and other things that are shifting in the industry.
Right. Well, my mantra is what gets measured gets managed. And what we've done is we've developed a lot of enterprise tools. And we have a portfolio and project management tool called Clarity that we use that tracks all of our projects from a performance allocation perspective. It looks at scope, it looks at schedule, it looks at issues, it looks at risk, and how to mitigate those risks. And it gives us a dashboard to track success of the project. And if there are issues, what do we need to do to get the project back on track? We also use HP Quality Center in our organization, which allows us to do centralized scripting and validate all of our requirements on these projects. Again, these are measurements that you need to determine success on these large-scale efforts. We also, as mentioned, use our Remedy service desk system to look at how many tickets have been opened, how many have been closed, and how many are still in transit to monitor and measure our performance across this particular organization. Again, given the growth and development across DHCS, it's important that we have these portfolio tools in place, and that really helps us with our success. And it helps us determine when there are failures and what we need to do to get those projects and initiatives back on track.
So how to be an effective leader is a continual conversation in both the public and private sector. And I think particularly right now in the technology industry, there's articles every day about the best leaders in this space.
Right.
As the leader of the Department of Healthcare Services and trying to trailblaze, can you share just some leadership best practices of how you're managing these information systems moving forward?
Sure. In our department, we're a very progressive department, and it's kind of a collegial environment. The CIO has a seat at the governance table with the director and chief deputy, and a lot of organizations in state government, that's not always the case. So it allows me accountability, responsibility, and authority to ensure that the successful outcomes are initiated. When I look at my management style, I look at myself as being innovative, progressive, transparent, and collaborative. They say it takes a village to raise a baby. It takes a village to run a successful information technology organization, and I feel like that we've laid the necessary foundation in which to do that. And again, it's an army of many, not an army of one, and that's most of what my leadership style is, and it works. I think setting a strategic foundation and getting and empowering people to do the things that they need to do to be successful and then supporting them helps contribute to our success.
So what's on the horizon? You have so many projects going on right now, but what's next?
Well, we have an IT strategic plan that we're getting ready to roll out, Christina, here in the next couple of weeks, and that also includes an annual performance review. We want to be accountable for the things that we do in the department. We want to align IT with the needs of the business, with its objectives, the goals, the mission and vision of the organization. So that plan will lay out that foundation and lay out a yearly performance review up to 2015 on ensuring that these initiatives are successful. And it's really important that we continue to grow and change as an organization, and we need to in order to be successful. It's a very dynamic organization, and there's a lot of moving parts here. And we want to ensure that we have the necessary governance structure in place and the necessary strategic IT vision that aligns with the needs of the business.
In a situation like yours, what do you think is the one thing that you need to be successful? So there's a variety of other CIOs from other states and even CIOs of private sector companies that are watching us today.
Right.
So what's that one thing, that key ingredient for success?
Continuity. You need to have continuity across your organization. You need to bring in people, you need to retain those people, and you need to keep them long term. And when you have continuity, you're going to have success. You can't continually bring people in and out. So my recommendation would be bring good people in, standardize on a core set of skill sets and a platform, and ensure that you have continuity within your organization.
Well, Chris, this has been an informative conversation, so thank you for joining me today.
Great. It was great being here. Thank you, Christina.
And thank you to the Techwire audience for joining us as well. Tune in next time for another conversation about the convergence of policy and technology.